So we shall start. So everybody, thank you so much for joining us today. My name is Malcolm Lewis. I'm the Chief Marketing Officer for Certimate. And if you're here today for our fireside chat on performance-based certification with Judith Hale, you're in the right place. A couple of quick housekeeping items before we get started. First, our agenda today is a 20 to 25-minute chat with Judy. I'll ask her a few questions. She'll provide some answers. And then we'll open it up and hopefully get some questions from you, the online audience. So this is very much for you. So please, if you do have any questions as we go through, make sure that you submit those through the Zoom interface, and I'll put those questions to Judy and we'll get them answered for you. Second housekeeping item, everybody will get a copy of the video for this chat. So rest assured, today, tomorrow, you will absolutely get an email with a link to the video. So with that, we shall get started. So again, Judith, thank you very much for joining us. For anybody that doesn't know who you are, could you perhaps introduce yourself to our audience?
Well, hi, thank you, Malcolm. And everyone, it's really a delight to work with you and meet you today. My name is Judy Hale, and I have been in the credentialing business for more than 30 years. I'm one of those consultants. I'm actually both. I'm a credentialing group. I bestow certifications, but I'm really known for my consulting and my publications in credentialing. So I've been in this business a long time. I've worked across practically all industries. I have, what can I say? I have helped people. I'm known for my ability in performance-based certification. So with roofers, that's their ability to get on the roof and actually demonstrate the ability to cut, seal, and all the tasks that they do. My international architectural lighting designers, their ability to actually design and install lighting that meets environmental factors and things like that. So people who size wheelchairs in developing countries. So I've done a lot of work internationally across all industries for both credentialing bodies and for associations and corporations who want to certify their entire supply chain or something like that. Well, Malcolm asked me to do this. He asked me to share a copy of my book, see if I can hold it here. It is a performance-based certification. It's published by Wiley, and it is the most referenced book. I get very nice royalties. It's used by both credentialing bodies and associations when they design their certifications. What else do you want to know, Malcolm?
Well, I think that's the perfect segue, Judy. So our topic today is performance-based certification. Great to have somebody who literally wrote a book on it. So let's get straight into, let's see, the first question. Let's just start at a high level based on your experience writing the book and working with clients. Why is certification so important?
Well, certification, and what I'm amazed is how it's mushrooming, it's growing so fast. And there's a lot of factors. One is the rapid change in work. Work is very different than it ever was before. But let's talk about the growth or something like that. Georgetown University in its research has shown that we are awarding about 1 million certifications a year. What's interesting is about a third of those people have already got degrees, whether it be associate arts, bachelor's, master's, and even PhDs. But that does mean that 2/3 of those people are outside the traditional academic path. The other thing is that they have found that certifications are the second most common awarded credential, and they are the bridge. They're working as the bridge between school, K-12, and employment. And they are really critical in doing that bridge because of the changes in the world of work. You might also know Credential Engine. Credential Engine is the official registry of certifications in the United States. And so far in their database, they have over 780,000 certifications registered with them. And Credly, you might know Credly. Credly is the global leader in awarding digital badges. and they award digital badges, in 195 countries. And I'll talk later, if we have a chance, about their trends, what they're seeing about what people are asking for in terms of certification. So the point is, it's really growing. The numbers are there. Okay.
Yeah, absolutely. And it seems like something that absolutely can help you get employed and help you get promoted.
Correct.
So let's see. So we've talked about the importance of certification. What's driving growth in certification?
Well, I alluded to briefly, it's really the change in the world of work. If anything can be automated, it is being automated. And that doesn't mean we have fewer people. It means that the work they do is different. Mm-hmm. Then we have all those people who are building the software tools, whether they're on your Android or your Apple, or whether they're being used at work. So the world of work is just changing phenomenally. And so these corporations need to know that people are competent to service their products. They call them aftermarket partners. So corporations are certified suppliers, aftermarket partners, the people who install, service, teach users. They're even certifying the users, the customers. Then we have the vendors of all this software, all this automation. They need capable users. So they too are certifying them. So this is what's bringing about this very large growth area in the area of credentialing. It's mostly changes in the world of work and the fact that we're a global economy and we need to be able to work across borders, if you will.
You know, and I read a couple of days ago that not only do we have a shortage in respirators and ventilators with the current coronavirus crisis, but there's actually also a shortage of folks that are actually trained to operate that machinery. So it was interesting that you talked about, you know, folks getting licensed and certified not only by organizations, but by manufacturers of complex equipment that need to train people to operate them. And I think the ventilator respirator issue that we're dealing with right now is a very good example of that.
Yes. Yes. Well, so if you build, like in nursing, and you build the drips, mm-hmm. You know, they program the drips, the frequency that comes in. Well, that nurse needs to know how to program that. They need to know how to monitor it. They need to know how to troubleshoot. And by the way, hospitals don't have one vendor. They have multiple vendors on each floor or whatever. So the nurse needs to be, if you will, multidextrous in his or her ability to program and properly use this equipment. And that's just one example. But throughout, more and more work is being automated. It's being done by multiple vendors. And those vendors need that user to know how to service, troubleshoot that piece of equipment. And they need you to be able to do it on the floor, not just call them to do it.
Yeah, so I think there's the traditional soft skills, like you know, again, if you're a nurse, giving a bed bath, but now there's some skills around operating equipment, and of course that equipment keeps changing. So certification is really a blend of those.
It is.
So given your extensive experience helping folks set up and implement these performance-based certification programs, what are some of the mistakes that you see organizations make when they decide to implement a program? And we'll have a follow-up question that talks about the consequences, but let's start with some of the most common mistakes that folks should try and avoid when they're implementing a new program.
Well, Malcolm, I should just tell you that I make my money cleaning up these mistakes, okay? Almost all my work.
So you're not going to answer the question, Judy, is that right?
Okay, the common mistakes. First of all, they're not clear on the goal. They all talk like they know what they want to do. They all talk about what they're trying to accomplish, but they've never taken the time to actually fully operationally define that goal. So therefore, they're not as clear on what they're going to measure to find out whether or not it worked. They don't have those in place. Next error is that they ask the wrong people. We call it sampling error. They include the wrong voices. They don't really look at the user, the other people who are vested, are stakeholders who have a vested interest in this. They might do a job analysis, but they don't do a practice analysis. They don't look at the larger picture. They have very poorly defined measures. I have seen some of the most unreasonable requirements. They're totally undefensible. their assessments at the wrong level. Now, I'll give you an example. My roofers have a literacy level of 3rd grade. Well, they don't need literacy skills on the roof. Okay?
Yeah.
So you have to be careful. Are you assessing their ability to read your test? Or are you assessing their ability to install a roof properly?
Mm-hmm.
They also don't validate their tests, and they don't really measure the results. Those are the big hitters. And those are the ones that I get called in to fix.
So I love the example with the roofers and making sure that they're even capable of reading and understanding the test to actually be tested by it.
Right.
You talked about unclear goals and lack of baseline measures. Can you give us a couple of tangible examples of where people started out with a lack of clarity and a lack of measurement, and perhaps just give us a tangible example of where you clarified the goal and gave them some very relevant metrics to measure success?
Well, one of the groups they wanted cleanliness as one of the standards, that you had a clean desk, clean work area, and things like that. And that's admirable. I mean, it really is. Cleanliness is great. Except some of their highest performance were a mess. So they couldn't prove that cleanliness correlated at all with doing this work, which is dealing with paper and data. So that's an example of wanting those kinds of things. I had another group that wanted to require that you had a high school diploma. Admirable, makes sense. Except they were certifying people in countries that do not have high schools.
Got it.
So how's that going to work? So that's a failure to look at the actual larger environment about what's going on, and imposing standards or requirements that might make sense to us in the United States, but really don't make sense other places.
Now, I know a hot topic is micro-credentials.
Yeah.
So a lot of the folks that are on the call today have got a very well-established certification program, so they're not really looking to implement necessarily a new certification, but they may be interested in implementing a smaller micro-credential. You know, if we're talking about the US and we're talking about an occupational or a professional certification organization, what might be examples of goals and metrics that they could define for perhaps a micro-credential?
Well, first of all, they need to really look at their population and see if their profile of their population is what they think it is. Okay? What we're finding in the United States that people's literacy level is lower than we expect. Their math levels are very low. Our knowledge of science, we are way behind many other countries. So where does micro-credentials come into place? If you have a certification and you have a population here, their ability to reach here might be too big for them. So micro-credentials are great ways of building scaffolding or ladders. So I would say the first thing, if you've got an participation that you want, you need to go back and look real hard at your population and see what's changed in the population and what's changed in the world of work. And then micro-credentials might make sense. It might make sense to either deal with certain practice areas, or they might help build the enabling skills to get people up to get to the larger credential. Does that make sense?
You know, it does, and it sounds like a lot of your work is more around credentialing, the performance of perhaps blue collar workers versus white collar workers. Although I think you have a mix, right? You've got roofers, you've got nurses, and so a little bit of both there.
Right. So one of the things is that the world of work, as I said, is changing, and you've been certifying people in your understanding of the world of work. And that was accurate at one time, but it may not be accurate anymore.
Yeah.
Because as the world of work puts in automation, does more outsourcing, requires more virtual work, that your standards might be slightly out of sync, but maybe your standards are great, they still hold, but what you find is that people do not get the adequate education to beat your standards.
Got it.
So your micro-credentials, again, become a stair-step, a ladder enabling to get them there, but it also allows you to address a marketplace need that your larger credential might be slightly out of sync with. I talked about uncommon mistakes. not really doing a job task practice analysis. I find we need to do them more frequently.
Mm-hmm.
We used to do them like every 10, 15 years, and that's not adequate anymore. The workplace is changing so quickly. We need to find ways to be much more current in our understanding of what the workplace requires of our intended certificates and what the educational community is really doing to prepare them. And do we need to create either micro-credentials to help bridge the gap, or do we have to provide educational tools to bridge the gap?
Yeah, and I think it goes, nursing or dentistry or veterinary medicine. You take any of these professions or occupations, and the core task hasn't really changed, but the tools and the technology that are made available to improve performance of that task have changed, and so you've got to be capable of using those tools and technologies to deliver the results that historically was just a fairly manual process with no tools or technology to help you.
Just as an anecdote to that, Malcolm, I met with the head of the School of Business of a major university, and he said to me, just give me one freshman that understands compound interest, please. Okay? Yeah. And so students are coming in that freshman level less prepared than they had been in the past. That doesn't mean they're dumb. It means that their educational stream is not in touch with what's going on. And they believe they're prepared, but they're not.
Yeah, and I think it ties back to our topic here, which is performance-based certification. At the end of the day, you're trying to prepare people to perform more effectively and produce better outcomes, whatever outcomes they are, whether it's a medical practitioner, making patients healthy, or whether it's an attorney or a plumber or a cosmetologist. There are desired outcomes, and if you're not training folks in the appropriate tools and technology to get the best outcomes, it's not really a performance-based program.
No, it isn't. I'll give you another anecdote, and these have to do with laparoscopic surgeons. Laparoscopic surgery is where it's going. Okay, we're no longer cutting you open from stem to stern. We're poking holes in you, and we're putting cameras inside you, and we're running tools in another way, and in very confined spaces. The surgeons are doing major pieces of work on the heart, the circulatory system, the digestive system. They now get gallbladders out this way, everything. What does that mean in terms of educating and testing those surgeons? You need to know that one of the issues is when they're poking that hole or using a little camera, is making sure they are where they think they are. Mm-hmm. So they have to be able, otherwise they're cutting in the wrong place. The other thing is that they actually have to cut and suture you. And it's like embroidery, it's fine stitching. It's fine motor skills. And so they have to be able to do that equally with the left hand and the right hand. So how do they, and by the way, they have three things in you, not two. They have a camera, they have something that cuts, they have something that sutures. Oh, by the way, you might be working with somebody else who's directing the camera. So they have to be able to communicate with that person to aim it in the right place. So this is a whole new way of doing surgery.
Right.
Now, how are we going to assess those surgeons in their psychomotor skills, fine motor skills, their ability to work effectively, communicate effectively with their team player so that they're in the right place doing the right thing?
Right.
And that's because technology has advanced in surgery, which is for our benefit, because the time to recovery is shorter, and there's a lot of benefits to the patients, right? But if their education and their assessment hasn't kept up with that, how do we do that?
Right. I think that's the key is it's, as to your point, it's a highly evolving workplace, and therefore certification has to evolve to go with it. So obviously you've helped a lot of people put programs in place that do attempt to adapt to this rapidly changing work environment. What are some of the best practices that you've established that you share with your clients to kind of help them adapt to this very rapidly changing workplace?
Well, first of all, they're going to a more higher fidelity exam, and that's performance-based. Now, the nice thing is that the testing technology is helping promote that. We can now do augmented reality, virtual reality. We've been able to create new ways of testing before, when we were just dependent on the classic multiple choice.
Mm-hmm.
Classic multiple choice will always have a role. Please understand, I'm not against it, but it's being augmented by looking at performance tests. Now, traditionally, so that's one of the biggest best practices, is looking at how we can make our tests look and smell like the real work,
mm-hmm.
higher fidelity, okay? And that requires us in the testing world to augment and embrace technology to make that happen. The other best practice is really to correlate what we're doing hasn't made a difference in the world.
Mm-hmm.
Now, in the end, I always tell my clients, the accountants will always win, okay? The people who count the money will always win. And if you can't show that because of your certification, something happened, people are getting better jobs, they're earning more, companies are showing a reduced cost of sales, reduced cost of service, fewer errors, higher safety. If you can't show that, you're going to be harder to prove the value of your certification. The other best practice has to do with the cost of administration. Again, technology plays a role. The ability to properly register, test people effectively. Right now with this pandemic, nobody can go to testing centers.
Right.
So that means we're revisiting our remote proctoring, our ability to set up situations. In fact, my Veronica is about ready to go. I think this coming week, she'll take a test at the dining room. She'll be able to show everything's going around. And a test that normally she had to go to a testing center to do. But the cost of administration is an issue. Next is those tests like the multiple choice. We're moving those closer to the training and not in the final assessment. Oh, the other best practice has to do with self-assessment.
Mm-hmm.
I am not impressed by high failure rates. If you have a high failure rate, that doesn't mean your test is hard. It means your candidate does not have a full, deep understanding of what you're expecting. And so you're better to have these self-assessments, readiness checks, whatever you want to call them, so that people come in and say, that's what I have to show. That's what I have to know. Then they can go and remediate, learn, catch up, and then they come in and take your test. Also, coming back to the mistakes, they have much better measures in place. In addition to participation, they're actually correlating participation against some larger issue. They have representative oversight. They engage. I frequently ask my clients, who hates you? Who really hates you?
Mm-hmm.
Maybe we should invite them in and find out why they hate you.
Mm-hmm.
And I've had them do that, and they've got a much more robust, higher validity exam as a result of it. Okay? But I think my final message is a certification is not a solution. It's a vehicle. It's helping you accomplish some larger goal. And that might be professionalizing your group. It might be reducing the cost of sales, errors, safety. It might be, but if you lose sight of what you're trying to accomplish, it's hard to really create an effective credential.
Yeah, I think, I hear a lot about folks that are trying to demonstrate, prove the value of their certification. And I increasingly hear about kind of closing that loop between desired outcomes and modifying components of the certification program, moving towards continuous certification. To your point, blending both knowledge with practical motor skills where that's practical or relevant, operating technology or equipment. And at the end of the day, whatever your profession, there's a very clear desired outcome. And if we can close that loop through certification and make it a vehicle to drive this virtuous circle of an ever increasingly positive outcomes for whoever you help as a professional, that can only help. Well, Judith, we have 25 minutes has just flown by. I actually had many more questions, but I do want to just make sure that I open it up to the audience for questions. So for those folks on the line, this is your chance. If you've got any questions that you'd like Judith to answer, you should see a little Q&A icon on your Zoom interface. Please click that and submit a question, and I will pass that on to Judith. So let's just give folks a second to do that. Let me close that. Okay, so on the topic of micro certifications, or even more broadly, a new certification program, in your experience, how long does it take an organization to from start to finish to introduce a new program, a new certification, or a new micro-credential? Two separate questions, I guess.
The classic answer is it depends.
Yeah.
It really does depend what they have in place, how well they. A very good worst example. I had one client, took them 6 years. Now, why did it take 6 years? One, they wanted it globally recognized.
Mm-hmm.
So the good news is they were smart. They took 6 years. As a result, they got it fully embraced around the world. All the standards they created universal standards. Most groups would never tolerate that time.
Mm-hmm.
They're looking for something in 6 months.
Is that the typical time frame target that folks are thinking about?
I would say a year tops would be more typical. That would give you time to convene people to really do a study of your work. And then based on that, you can say, how are we going to assess them? What's the design going to look like? Now, design includes eligibility, who we're going to allow to play.
Mm-hmm.
What do you have to do to even be here? Next, how are we going to, what do you have to do to earn it? Do you have to take a test? Do you have to take training? Do you have to be 7 feet tall? What do you have to do to earn it?
I would fail that one.
Okay, I would too. And the other one has to do with what do you have to do to maintain it?
Mm-hmm.
Are we going to require them to test, retest? Are we going to encourage continuing education? What's in place? And so you can usually get it done within a year, but it takes some getting the right people at the table, doing some, but if you don't know anything, it takes longer. And if, like in that other example, if you really want your standards to be embraced around the world, that means you have to test this out. So I was doing webinars at 2 a.m. answering questions.
Mm-hmm.
Because whether you were in Jakarta or India or, Egypt or Sydney or Sao Paulo, didn't matter. They really wanted a global set of standards and took the time to earn it. So it wasn't the U.S. shoving it on you.
Right.
That's what they did not want that.
So it's a two-pronged approach, right? You've got to educate the population of folks that could acquire your certification, and then educating their potential employers that there's value in them having this certification, because if there's no benefit to them, they won't get certified, right?
No, that's correct.
Okay, let's see if we've got any other. Oh, we do. So, so this question is: do you feel that knowledge-based exams? So you mentioned moving MC to earlier. Do you feel that knowledge-based exams should do this, while performance-based later, closer to the final certification?
It really does depend on the content. Some things they need actual practice as they're going on. So it's like there's no single answer. If I were really testing digital hand skills or something like that, or your ability to do something, or even if your ability to analyze complex data, I don't want to say that to the end.
Mm-hmm.
I would do my knowledge tests as building blocks, but I would start looking any way I could to introduce them of applications, solving problems, case studies, practice, something like that. Yeah. So I don't mean it's like one and then the other, but I really do think you have to look at your own content and what it is you're doing. Let's talk about data analysis. I can do all the knowledge tests related to ANOVAs and chi-squares and, you know, Chromebox and a whole bunch of things like that. But I should be giving you opportunities to apply those rules.
Mm-hmm.
I should be giving you data and showing you how to work with the formulas. And that shouldn't be a thing at the end.
Right. It should be, knowledge should be always acquired in tandem with application too. Again, we go back to the goal is to produce better outcomes, because unless certification provides better outcomes, it doesn't provide any true value. Another question, do most performance-based certification programs also include a written testing component?
Frequently they do, because you want to know if they do. It has higher faith validity. Mm-hmm. Okay, people say, oh, you check to make sure they really know the rules. So it saves you a lot of grief. So many of them have a what we call a traditional multiple choice rules of the road kind of thing, just like your driver's test.
Right.
Take a rules of the road, and then you get behind the wheel.
Yeah.
So there are those kinds of examples. Yes.
And they're both equally valuable, right?
Yes, absolutely, absolutely. But we have for too long just relied on the knowledge component.
Right.
And then assumed if you know it, you can do it.
Right. And
employers are suspect. They don't trust that. They want to know that you can actually have done it.
And in fact, and I apologize to anyone that needs to drop off. We're going to keep going for another few minutes here, even though we normally target 30 minutes here. But this is an interesting topic, and I wanted to get your thoughts. I've started to see some performance or competency assessment systems that are video based. So I'm curious so obviously the idea is, you know, again, I always use my example of nurses, you know, giving a bed bath. You know, you can answer 50 questions on that, but then you video 10 nurses giving a bed bath, and you're going to quickly see who does it well and who doesn't. What are your thoughts on video assessment for performance or competency testing?
I think they have very high validity. My roofers, we can't go on the job and climb up on the roof. So there's two things here. The judges of the roofers, we show them video, and they have to spot the mistakes real time. There are no reruns. Mm-hmm. There's no real runs in life, right? But you, as a roofer, can also be taped, right, in a mock-up situation, and you can be videotaped putting on your harness, and they'll spot right away whether or not you know how to do your safety harness properly. And you can then be videotaped doing your sealing, gluing, whatever. And video has high validity. I offer certification for people who facilitate training, and that test requires the person to submit a video of themselves doing very specific behaviors, and they know what those are. They know what the scoring tool is.
Right.
So they know what the judges are looking for. So video is very good.
Now, I believe, correct me if I'm wrong, you do a lot of work in the dental industry.
Yes.
What would be an example of performance competency assessment in that environment?
Well, here's two examples. One's the cosmetic dentist.
Mm-hmm. Cosmetic
dentists submit pictures, and they're given training on how to actually do the photography part of pre and post. Mm-hmm. They take pictures before they do something, during it, so they know when to stop and take pictures, and then they submit the final thing, and that is part of their test. That's very much performance-based. Mm-hmm. They're doing real work on a real patient. Oral surgeons have a different approach. They are given case studies, which they're given 20 minutes to study, and they get the data like they would see in the hospital, so they know your blood count and all that kind of biometric stuff.
Right.
And then they go to a panel, and the panel asks them a series of questions. The panel has already agreed on the questions, and they already have a scoring rubric to know what must be present in your answers. And you are then go to an interview about what you do before, what are the challenges, how would you handle it. And theirs is an oral interview. It's not as high fidelity as my cosmetic dentists, who are showing actual photographs of real patients in process. those are two examples in dentistry.
Yeah. Let's see. If anybody has any last questions here for Judy, please post it now. I think we've had our last question, Judy. So it just is left to me to thank you so much for joining us. It's been a great pleasure. We will distribute the video. We'll have a few written notes that summarize the questions and answers that we provided here. And of course, if you really want to dig into performance-based certification, then Judy has a book for you. So, oh, and here it comes again.
Yes. Per Malcolm's request, right? Performance-based certification published by YLA, yes.
So again, thank you, everybody. And thank you, Judy. Everybody stay safe and stay healthy. Yes. And thank you very much. Bye-bye.
Thank you, Malcolm.